Welcome to Bloom. In this video, you will learn useful information about genetic testing for hereditary risk of cardiovascular disease, as well as the types of results it can provide. Learning if you have an increased genetic risk for cardiovascular disease can make a difference. Cardiovascular disease is complex and has many causes. Most cardiovascular diseases are environmental and not due to one identifiable cause, but about 10 to 15% of certain cardiovascular diseases are due to harmful genetic changes called mutations that are passed down through families. The Bloom Genetic Risk Analysis is designed for women and men to detect mutations in a comprehensive set of genes associated with common hereditary cardiovascular disease, such as cardiomyopathy, arrhythmia, arteriopathy, and familial hypercholesterolemia. Understanding if you have a genetic predisposition to cardiovascular disease allows you and your healthcare provider to create a screening and prevention plan that is tailored to you. This is important because detecting cardiovascular disease at its earliest stage improves the likelihood of a favorable outcome. Screening is useful for men as well as women. Half of all people with mutations are men, and just like women, men have a 50% chance of passing a mutation on to each of their children. The Bloom process begins with a medical assessment done over the phone to first determine if you have a hereditary risk of cardiovascular disease. The completed assessment is reviewed by a certified licensed pathologist, and if, in their professional opinion, there is a risk, the pathologist will send the medical assessment to your primary care physician, along with a request to authorize the Bloom Genetic Cardiac Test. The Bloom test must be ordered by your primary care physician. A specimen kit consisting of a simple cheek swab is then shipped Priority Express mail directly to your home at no cost to you. Once it arrives, a counselor will call and walk you through the process, and you will simply mail the specimen kit back to the lab. Once the laboratory performs the genetic test, those results are sent to your primary care physician. We believe it's important for you to understand what can and cannot be learned from genetic testing. Genetic mutations can increase risk for certain cardiac conditions, but this does not mean heart conditions will definitely develop. A positive result or finding a mutation is not a cardiac diagnosis and does not mean that you will ever develop heart conditions. For example, 1 in 200 people have a heart condition with a genetic basis. If left undetected and untreated, these conditions can be life-threatening. Genetic influences make up 48% of risk for coronary artery disease. Many arrhythmias have a genetic or inherited component. Genetic testing is used to determine whether or not someone is at risk of a potentially dangerous arrhythmia because of his or her family history. The level of increased cardiac risk differs from gene to gene. Even if your results show no mutation, you may still get a heart condition. While inherited mutations explain some cases of heart conditions, the majority are sporadic and can't be explained by a single cause. Some non-genetic factors that can influence cardiac risk include environment and lifestyle, as well as family history, without a known genetic link. No genetic test detects everything. In addition to genetic testing, family history and lifestyle play important roles in assessing your risk for a cardiac condition. You should be prepared to receive positive or negative results. Most people receive a negative result, meaning no mutations associated with an increased risk for the hereditary cardiac conditions covered by the Bloom test were found in the genes we analyzed. While this can be reassuring, particularly for those with no family history of cardiovascular disease, it does not eliminate your risks. Since environmental factors in a family history without a known genetic link account for the majority of cardiovascular and cardiac conditions, it's important to follow the screening and prevention plan recommended by your healthcare provider. A small percentage of people receive a positive result, meaning a mutation that increases risk for one or more of the hereditary cardiac risks covered by the Bloom test was identified. In the event of a positive result, a genetic counselor will assist your primary care physician in analyzing the results and create a screening and prevention plan that is tailored to you. Keep in mind that a positive result does not mean that you have a cardiac condition or that you will definitely develop cardiac conditions in your lifetime, but it is important that your results are shared with your primary care physician. It's normal to have variants of uncertain significance. We are all different at the genetic level. It is common to see changes in genes that require further research to determine if they are associated with an increased risk for developing cardiac issues or cardiovascular disease. Most are eventually found to be harmless. Mutations that impact risk for cardiac issues covered by the Bloom test can also increase the risk of developing other cardiovascular diseases. This means we may come across information about your genetic risk, depending on the gene in which a mutation is found. If we believe your risks for these cardiac and cardiovascular diseases are increased due to a mutation, we will let you know. Regardless of the type of result you receive, they should be shared with your healthcare provider. This can help you and your provider create a personalized screening and prevention plan. You can learn more about hereditary cardiac risks and the Bloom genetic test by visiting our website at www.mybloom.life.